Hi, I'm Adiola Sabia. I'm a qualified psychotherapist and counselor, and I'm just welcoming you this morning to this very brief session on therapy. I'm suspecting that if you're watching this, it's because you're either interested in therapy or you know somebody who might be interested in therapy. And so, really, what we're just going to talk about is what to expect in therapy, just so that you can see if you're ready for therapy. I'm going to be using my cue cards. So, the first question really is, why do people come to therapy? Well, people come to therapy for different reasons. We're all unique with different presentations, going through different things in life. But generally, it could be because you're feeling stuck, you're feeling hopeless, you have some personal issues and you don't really know how to navigate them. So just sending you to feelings of overwhelm, anxiety. And if you are in that stage where it's just too dark and just things are just so busy and you just can't sort it out on your own, it might mean that you need therapy. And it could also mean if you're feeling suicidal, because life can get scary, and that sometimes is an option, and we will look at what's going on. It could also be because you feel some kind of disconnect. So there are various different reasons. I mean, I work with the NHS, and that gives me the privilege to work with people from different backgrounds, with different presentations. And so I will also work with from a culture competent approach, which means that I consider your psychological, physical, emotional aspects, which might be causing you some emotional distress. Just looking at your lived-in experiences and just seeing how race and culture might have an impact. What is the therapy space? What do we do with the therapy space? It's a place for you to explore your thoughts, your feelings. We live in a very, very quick and changing world. And so sometimes we're on autopilot, just trying to get from one day to another. And some things may come up that give us concern, but we don't have the space all the time to explore, to reflect, and to really check in with ourselves. And so I would say that therapy is also self-care, because it enables you to just put yourself forward in a space where you can think, where you can reflect. And also working with me, because I also work from a psychodynamic point of view, which means that I will be looking at unconscious patterns, things that you're not aware of that you do. So we will work with that. And if you decide to work with me, I'll be able to talk to you a bit more about that. What is the outcome? What do you expect to get from therapy? Well, some of the clients I've worked with feel a sense of relief. They get a sense of direction. They feel a sense of self-worth, which they didn't have before. It's also a space where you can understand and make meaning from current and past events. And also, I would also say some clients have come up with new ways of thinking, being able to present their authentic self. And it's all about emotional resilience, so that you become your own therapist. You check in with yourself from time to time. What is my approach? Well, I'm an integrative therapist, and that means that I will use different modalities depending on what suits you best as a client. So I'm using different tools in a way that best suits your presentation. I'm also coming from a cultural competence point of view, because I will also consider your race, your culture, your values. And I will also give space to talk about your faith and your spirituality. Why me? Why would you want to work with me? I believe that we're all unique as counselors and psychotherapists. And we might look the same, sound the same, have some of the same qualifications, but we are still different. So I will encourage you to do a bit of research, make a few phone calls, talk to a few therapists. And that gives you a feel as to whether you feel that we're on the same page, we understand your point of view, and that will give you an inkling on whether you will feel comfortable working alongside this therapist. And I do want to emphasize that it's important for you to choose the right therapist, because a client-therapist relationship is very key to an effective therapy. A question that keeps arising: will I prescribe medication? And the answer is no, and neither will any other counselor or psychotherapist. We don't have the clinical capacity or the qualification to diagnose. I would encourage you to reach out to your GP. They're in a better position to be able to diagnose. And then if they also feel that you might do well with counseling, they might refer you to a counselor or a psychotherapist. And lastly, if you feel that you are ready for counseling, I do offer a 15-minute free consultation. And when you come, it's a space to talk about what's bringing you to therapy, questions that you might have for me. And it's an opportunity for me to talk about what I bring to the table in terms of my clinical approach. And this is, again, will help you to decide on whether you feel that we make a good fit. If we both feel we make a good fit, then you can schedule your first session with me. So I look forward to hearing from you and starting this journey of self-discovery. Take care. Bye-bye.